We're in 1991. 1992, I go to an all-day conference on brain SPECT imaging given at the American Psychiatric Association, which I've been a member of for many, many years. And the child psychiatrist at Creighton University talked about how it can guide treatment and help you be a more effective physician. And they were finding exactly the same things I was finding, and it was so exciting. But at that same meeting, researchers were complaining we shouldn't do it, clinicians shouldn't do it, it was only for their research. And I remember getting into a fight with Alan Zemeckis from NIMH, and he's like, no, you shouldn't be doing it, it's only for research. And I'm like, but you're doing it, and if you're not doing it to help me be a better doctor, why are you wasting taxpayer money? And I was just furious because I'd seen how helpful it was, but I saw that the academic community, because they weren't thinking like clinicians think, which is, will this help my patient? And you'll see, I'll demonstrate to you how helpful this is. They were like, no, no, it's ours, it's not practical for you. And so here's my response. Okay, without imaging, we are then practicing psychiatry of the 1840s. And I'm not kidding when I say that. So why do I say 1840? Because Lincoln is one of my heroes. I love Lincoln. He failed repeatedly. And then he became a wild success. He's on your penny. I mean, that's longevity success. And he was our best president, but he suffered from depression. And in the winter of 1840, he was suicidal. In fact, his friends took his knives from him. And he went to see his doctor, Anson Henry. And how did Dr. Henry diagnose him with depression? He talked to him. He looked at him. He looked for symptom clusters, and then he diagnosed and treated it. You tell me that's not exactly what we do in psychiatry today. And that's not okay with me. It's not as good as we could do. And people go, oh, well, they're not all the perfect studies, so that we'll use this clinically. It's like, seriously? The alternative is not to use anything and to be stuck with Anson Henry. Oh, by the way, when Lincoln was 10, he had a serious brain injury. He was kicked in the head by a horse and was unconscious all night long. Maybe that would have had something to do with his lifelong struggle with depression. Although, I just have to put this little caveat in. Lincoln did suffer with depression, and today we would not elect him as president because of his mental health history. But it was because he suffered. It is because he knew how to suffer that he could actually be the president at the darkest time in our country's history, because he was smart and he paid attention to his suffering. So if you suffer from a mental illness, pay attention to the lessons that it is teaching you, because it often provides the seeds for greatness.